Never do this when holding your urine. It sounds like a small thing, an annoying inconvenience, but over months and years, that habit can quietly set off a chain of problems that steal your sleep, increase infections, and make prostate-related symptoms worse. I'm Dr. Camila Vega, a urologist with over 15 years of experience caring for men's urinary health. And today, I want to explain exactly why delaying a trip to the bathroom is more than just uncomfortable, and what you can do about it right now. Most men have held their pee at some point, in traffic, in meetings, on a long flight. I don't want to shame anyone. I understand life gets in the way. But there's a difference between the occasional delay and a repeated habit of holding urine. Repeatedly forcing your bladder to stay full can contribute to problems that are slow to show up but hard to reverse. Stick with me. I'll give you a simple 30-day practice that can make a measurable difference in how you feel and sleep. To start, a quick picture. Think of your bladder like a balloon that's also a muscle. It stores urine, and when it's time, it squeezes to empty. That squeezing muscle is called the detrusor. The prostate is a small gland that sits just below the bladder and wraps around the urethra, the tube urine passes through. Because the prostate sits like a valve around that tube, anything that causes swelling, pressure, or poor emptying can make urine flow slower or weaker. When you deliberately hold urine, the bladder stretches beyond its comfortable capacity. Stretching the balloon repeatedly can weaken its ability to contract efficiently. That means the bladder may not squeeze as strongly when you finally go, leaving some urine behind, what we call post-void residual, or PVR. A higher PVR gives bacteria a place to grow, increasing the chance of urinary tract infections. Over time, repeated infections and chronic irritation can cause inflammation that affects both the bladder and the prostate. In other words, holding urine sets up a domino effect. Overdistension, residual urine, bacterial growth and inflammation, weaker bladder contractions, and more urinary symptoms. There's another habit I see often that is closely related and equally damaging: straining or pushing when you urinate. Some men push with their abdominal muscles because the stream is slow or feels incomplete. Pushing creates abnormal pressure patterns. Essentially, you're forcing urine out against a partially narrowed tube. That counterpressure is stressful for the prostate and the bladder muscle. If holding urine increases the chance of incomplete emptying, that incomplete emptying tempts men to push when they finally go. So the two behaviors, delaying urination and straining during urination, can feed each other and accelerate the cycle of dysfunction. You don't have to take my word for it. In clinic, I routinely evaluate men who complain of waking multiple times at night to urinate, weak or intermittent stream, dribbling after they finish, or a constant feeling that their bladder isn't empty. These are the warning signs to take seriously: getting up 2, 3, or more times at night, needing to rush to the bathroom because of sudden urgency, a weak or interrupted stream, dribbling or leakage after you think you finished, recurrent bladder infections. These symptoms affect sleep, energy, mood, and overall quality of life. They're also the early signals that the bladder and prostate are not working as efficiently as they once did. How does this play out physically? When the bladder stays overfull, its walls become overstretched and less able to generate a strong squeeze. That means urine remains after you void. That residual urine increases the risk of bacterial colonization and infection. Recurrent infections or chronic irritation can lead to inflammation and scarring, which can narrow the urethra or alter bladder function. A bladder that's been weakened by chronic overdistension may develop what we call detrusor underactivity. The muscle becomes lazy and less responsive, making it even harder to empty completely. This creates a feedback loop. Worse emptying leads to more residual urine, which leads to more infections and inflammation, which further impairs emptying. Over time, what may have started as an occasional habit becomes a persistent problem. So what should you do instead? The good news is that many habits are within your control. The core rule is simple. When you feel the urge to urinate, go as soon as it's reasonably possible. Make "don't hold it" your default. That single change can prevent repeated overdistension and reduce the risk of the downstream problems I just described. But there's more. When you do go, voiding technique matters. Don't push or strain. Instead, practice relaxed voiding. Take a slow breath in, then breathe out gently as you allow your bladder to contract. Relax your abdominal muscles and your pelvic floor. Yes, the pelvic floor muscles should relax to let urine flow. Think of letting the bladder do the work. Trying to force urine out with your belly creates unnecessary counterpressure and can harm the bladder and prostate over time. If you already have symptoms, slow stream, feeling incomplete, try sitting to void. Sitting can make it easier to fully relax the pelvic floor,
and often improves emptying in symptomatic men. It's not a cultural judgment, it's a practical recommendation for those who are already experiencing problems. For many men, sitting results in a more complete emptying compared to standing, especially when combined with relaxed breathing. There's a simple trick I recommend to patients that takes about 10 seconds and can reduce residual urine: double voiding.
After your first stream, wait about 10 to 20 seconds. Lean forward slightly, relax again, and try to void a little more. That pause gives the bladder a chance to finish emptying. You'd be surprised how often a small second pass removes what's left. This is a low-tech, low-risk habit that can be helpful, especially after a period of holding or when you feel incomplete. Hydration timing matters too. Drink sensibly throughout the day rather than loading up all at once. Spread your intake to keep urine dilute and regular. For nighttime, try to limit fluids in the 1.5 to 2 hours before bed. That doesn't mean you should be dehydrated. It means adjusting timing so you're less likely to wake up multiple times. Also be mindful of caffeine and alcohol, especially in the afternoon and evening. Both are diuretics and bladder irritants. They increase bladder activity and can make urgency and nighttime urination worse. Here are practical steps you can start tonight. Make a plan for timely bathroom trips. Don't wait until your bladder is painfully full. When you go, breathe and relax. Don't push. If you have symptoms, sit to void. Use double voiding as a routine follow-up. Spread fluids during the day and reduce evening caffeine and alcohol. Keep a simple log for 30 days. Note how many times you wake at night and whether your stream felt stronger or weaker. Small changes repeated daily can lead to meaningful improvement. If you want a structured approach, try a 30-day practice. For the next month, commit to not delaying urination when you feel the need. Practice relaxed voiding every time. Sit if you have symptoms, and perform double voiding after each urination. Track your nights, count how many times you wake to urinate, and write down any change in stream or the feeling of completeness. At the end of 30 days, you'll have information to see if these behavioral changes helped. If you want a short challenge to start, a 14-day version is a quick engagement, but make the 30-day habit challenge the main plan for sustained benefit. A few questions I get often. If I've already had symptoms for years, will changing habits help? Habit changes can reduce symptoms in many men, improve emptying, reduce infections, and improve sleep. But they are not guaranteed cures, and the degree of improvement varies. If your symptoms persist despite practicing these habits, it's time to see a urologist for evaluation. There are tests that measure how well your bladder empties and how strong your urine flow is. A post-void residual measurement tells us how much urine is left after you go. Uroflowmetry measures the flow rate. An ultrasound can look at your bladder and prostate size. These tests help determine whether symptoms are due to bladder weakness, obstruction from an enlarged prostate, or other issues. If obstruction or severe symptoms are confirmed, there are medical and surgical options, but these are for selected cases and are determined by a clinician. Options can include medications that relax the prostate or bladder, minimally invasive devices like Urolift that reduce prostate obstruction in appropriate candidates, temporary stents, or other procedures. These treatments can be effective for men with significant obstruction or large prostates, but they're not replacements for good urinary habits. Think of habit change as the foundation. Clinical interventions are for when the problem is severe or unresponsive to conservative measures. There are also urgent signs that mean you should seek immediate care: inability to pass any urine at all, blood in the urine, fever with urinary symptoms, sudden severe pain, or symptoms that rapidly worsen. Don't wait to see if these resolve on their own. For less acute issues, persistent nocturia, recurrent infections, progressive weak stream, schedule an appointment with a urologist to get proper testing and tailored advice. Let me give a few scenarios to make this concrete. Maybe you're on a long flight and you choose not to get up. That's understandable. One-off events happen. The problem is when you routinely delay until your bladder is painfully full because of work patterns, meetings, or a habit of holding it until the last minute. Or maybe you always delay because public restrooms bother you. There are workarounds. When possible, plan breaks, use trusted facilities, or adjust fluid timing so you're less likely to be caught out. The aim is to avoid chronic overfilling. Another common scene: you feel your stream is weak, so you push to get more out. Pushing might give immediate relief, but reinforces the problem. Instead, try sitting, breathing out slowly, and letting the bladder contract. After the mainstream, wait and try double voiding. These small behavior tweaks change the mechanics and reduce the damaging counterpressure created by pushing. You may ask, how long before I notice a difference? I can't promise a specific timeline. Everyone's body is different.
Some men report improved sleep and fewer nighttime trips within a few weeks of practicing these techniques. Others with long-standing issues may need more time or further evaluation. That's why the 30-day practice is a good, realistic goal. It gives you a month to form new habits and gather data on whether things are improving. Let's go over the top 3 takeaways again so they stick. First, don't hold your urine habitually. Go when you feel the need. Second, when you void, don't push. Breathe and relax the pelvic floor, and consider sitting if you have symptoms. Third, practice double voiding and sensible fluid timing. Spread fluids during the day and limit evening caffeine and alcohol. These 3 steps are the simplest, most impactful actions you can take today.
If you try this 30-day approach and your symptoms improve, keep the habits, they're protective. If symptoms don't improve or if they worsen, schedule an evaluation so we can measure post-void residual, check urine for infection, assess flow rates, and discuss whether medical or procedural options are appropriate for you. I can't overstate that timely evaluation helps guide the right treatment and prevents avoidable complications. Before I close, a quick practical checklist you can use tonight. Set an alarm on your phone for a regular bathroom break if your work keeps you from noticing urges. When you go, sit if you can, take a deep breath, relax your stomach and pelvic floor, allow the bladder to empty without pushing, and wait 10 to 20 seconds to try double voiding. Reduce coffee or alcohol in the late afternoon and avoid drinking large amounts right before bed. Keep a simple notebook by your bed to record how many times you wake up to urinate for the next 30 days. If this message resonated, do one quick thing right now. Hit the like button so other men can find these practical tips. Then, if you're ready, take the 30-day practice challenge I just outlined. Leave a comment after a week and tell me how many times you've woken at night. I read many of these, and we can discuss common issues. If you want a faster start, try the 14-day variant to build momentum, but aim for 30 days as the main goal. I know these issues can feel embarrassing or like they're just part of getting older. They don't have to be accepted quietly. Small, consistent changes can protect bladder and prostate health and get you better sleep. If at any point you notice blood in your urine, fever, severe pain, inability to urinate, or a sudden and significant worsening of symptoms, seek medical care right away. Thank you for listening. Take the 30-day challenge. Don't hold it, don't push, sit if needed, double void, and manage fluids sensibly. If things don't improve, see a urologist for testing and a personalized plan. Protecting your urinary health is about habits, attention, and timely care, and it's something you can start changing today.